Worldwide, diabetes is rising dramatically in such a way that it has now been recognized as an epidemic. Every 10 seconds, 2 people are diagnosed with diabetes. From 30 million people in 1985 to more than 380 million in 2013, it's estimated that by 2025, more people will be affected by diabetes than the entire population of the United States, Canada, and Australia combined. These numbers are staggering, and it's concerning because every 10 seconds a person dies from diabetes-related causes. Why has the incidence of diabetes increased so much? As a disease of lifestyle, rapid cultural changes, an increase in obesity, aging populations, increased urbanization, dietary changes, and a decrease in physical activity has all led to what we see today. Studies such as the UKPDS has proven that diabetes can be minimized by lifestyle factors. So where does macrovascular disease fit in? Adults with diabetes are 2 to 4 times more likely to die of a heart disease compared to those without diabetes. As the leading cause of heart attack, stroke, blindness, amputation, and kidney failure, there is no such thing as a mild type of diabetes. Preventing cardiovascular disease includes primary prevention strategies, management of hyperglycemia, hypertension, dyslipidemia, obesity, and smoking cessation. What is the perfect blood sugar level? High blood glucose levels damages blood vessels, so one would think to go as low as possible. Some studies, however, have proven that this is not the case. Looking specifically at preventing cardiovascular disease, a blood sugar level above 6.5 millimoles per liter is recommended for most patients. But everyone is different, so therefore discuss your personal target with your diabetes education and make sure that you go for regular checkups. The long-term measurement of glycemic control of around 3 months, known as HbA1c, is recommended around 7% to reduce the risk of complications in the future. Now that we know what we need to aim for, the blood glucose targets, let's look at other ways to manage blood glucose control, dyslipidemia, hypertension, and obesity. Our first tool is called the South African Food-Based Dietary Guidelines. Number 1. Enjoy a variety of foods. This means if you love to eat fruit, make sure you have a variety. Same with vegetables and starches. Number 2. Make starchy foods the basis of most meals. Number 3. Chicken, fish, meat, milk, or egg can be eaten daily. Ensure that you choose a lean protein option. Remove the skin of chicken before cooking. Make sure you choose a lean cut of meat. And don't fry your eggs, rather boil or scramble. Number 4. Eat plenty of vegetables and fruit every day. Just make sure that you are aware that fruit will affect your blood sugar levels and therefore have it nicely spaced between meals. Number 5. Eat dry beans, peas, lentils, and soya regularly. Not only are these low GI options, which we will cover now, but they are also very high in fiber. Number 6. Use salt sparingly. Number 7. Use fat sparingly. Number 8. Drink lots of clean water. If you drink alcohol, number 9, drink it sensibly. It is important to remember here, if you are taking insulin, that it's not responsible to have alcoholic drinks and not eat, as it can easily induce a hypoglycemic episode. Number 10. Use food and drink containing sugar sparingly and not between meals. Rather have it with meals and in moderation. Number 11. Be as active as you can and try to get every opportunity to move around as much as possible, as we are all leading more sedentary lives. The second tool we will look at is called the plate model. This is a simple way to plan a balanced diet through appropriate portion sizes and in the perfect relations. Foods are divided into 5 basic food groups. Number 1, starches and cereals. Number 2, vegetables. Number 3, fruit. Number 4, milk. And number 5, protein options. Looking at your plate, divide your plate into 4 quarters. A quarter of your plate should be your starch. This should include starchy vegetables such as sweet potatoes, potato, peas, yams, pumpkin, and corn. Obvious starches such as rice, whole grains should also be included. A quarter of your plate should then also be protein options like meat, fish, poultry, legumes. The other 2 quarters that are left should both be filled so that half of your plate should consist of vegetables, preferably non-starchy veg, low in carbohydrates, typically the ones you would put into a stir-fry or a salad. Options include cabbage, broccoli, green beans, mushrooms, tomatoes, cauliflower, lettuce, cucumber, spinach, peppers. Add 1 cup of low-fat or fat-free milk and a piece of fruit which can serve easily as a dessert. The third tool we will use is called the glycemic index. The glycemic index is established worldwide for the carbohydrate content of food and how they affect your blood sugar levels. Some will cause a low response, while others will cause a high response. The portion size of carbohydrates will also influence the glycemic response, described as the glycemic load. In other words, having a large, low GI meal might as well have a high glycemic load. So it's very important again to refer back to the plate model and keep your portion sizes in check. Looking at the glycemic index, you will see that glucose has a higher curve and a much rapid higher increase in blood sugar levels than lentils, for example. The quicker the onset of the blood sugar levels, response needed to cover. Therefore, the benefits seen from low GI eating, it promotes healthy eating, it increases fiber intake, it helps to control your appetite, your blood sugar levels or blood glucose levels, your blood lipid levels, and it assists with weight loss. You are probably thinking, what about fad diets? A study published in the British Journal of Diabetes and Vascular Disease showed that most of the evidence for fad diets is not based on control, well-planned long-term studies, but on short-term results. There are many fad diets. Some recommend high protein intakes, eating mono foods only, high carb intake, low carb intake, very low fat intake, and very high fat intake. The problem with these diets are they are not sustainable. Severe calorie restrictions often lead to micronutrient deficiencies. Once a person goes back to eating the way you did with old eating habits, the weight gain just occurs. Long-term weight maintenance is rarely successful for fad diets. If it sounds too good to be true, it probably is. Studies show that behavioral factors have much higher impact over weight loss than macronutrient compositions only. An increase in physical activity while modifying your eating habits is the best solution for long-term weight loss. Tips to help you stick to better dietary habits. Get rid of unhealthy foods in your kitchen, your pantry, your car, your drawer at your desk. Throw it away. Buy healthier foods, because if you buy them, you will eat them. Stock up on vegetables. Keep a frozen pack of veggies in your fridge and freezer so that you always have an option when you run out of fresh vegetables. Always have a fruit bowl ready, at hand and in sight. Snack on fruit instead of snacks that are high in fat and comes out of a wrapper or a label. Find time for your new habits by changing your schedule. If you would like to add more activity into your lifestyle, like going for a morning walk, get up a little bit earlier so you'll have the time. If you struggle to get out of bed, then don't put your alarm clock next to your bed, but rather a bit away so that you have to get up to put it down. Put things like your exercising and training times on your calendar. Buddy up with a friend or a family member. Plan ways to get around any obstacles that might come up. Take packed lunches to work instead of hitting the vending machine or cafeteria. Ask for support from family and friends and your healthcare team. Keep your efforts by writing down what you're doing. Use a calendar or notebook, a pedometer, or an online food and activity tracker. And reward yourself for sticking with your plan. Take time to do something special for yourself. Remember, it's not easy to make these changes because you are swimming upstream. If we just look at those stats in the beginning, it's clear to see that everyone around you is getting more obese and more prone to diabetes. So yes, you are going to be the one who orders a salad with your meal, have a glass of water when you want to have a cocktail, and maybe always carrying a bottle of water with you. You are going to be the one who exercises and has to skip up on a round of drinks at the nearest pub. But it's all going to be worth it in the end. So let's summarize this. Remember to go for regular checkups. Your health is worth it. Take your medication the way your healthcare professional advised you to. And stop smoking as soon as possible. Be active, plan this, and make it happen. And then make healthy food choices. This is the only body you have.